Good morning. Thank you all for being with us today, for those who are here in person and those who are here on our live stream. My name is Shari Cohen. I'm the president of the Hepatitis B Foundation and a professor at the Baruch S. Blumberg Institute. It is my pleasure to welcome you to today's event. Yesterday, July 28th, was World Hepatitis Day, and also would have been Dr. Blumberg's 100th birthday. We are here today with friends, family, and colleagues to commemorate his legacy and celebrate his life. Joan Block, co-founder of the Hepatitis B Foundation, was the first person to acknowledge that the hepatitis B story is the real Philadelphia story. We hope to make a movie about it one day. The hepatitis B virus was discovered in Philadelphia. The first diagnostic test was made in Philadelphia. The first vaccine was developed in Philadelphia. Actually, 2 of the 3 vaccines have been produced and manufactured in Philadelphia since the 1980s. The woodchuck, which is the first scientific model to test the virus, was found in Pennsylvania. And of course, you have the Hepatitis B Foundation and Baruch S. Blumberg Institute, which together probably are the greatest concentration of people working on hepatitis B elimination in the country, maybe even in the world. So we are here in Philadelphia, and the legacy lives on. Today, we're going to focus on the first part of the Philadelphia story, how Dr. Blumberg and his team made groundbreaking scientific discoveries and how Philadelphia became the center of the hepatitis B world. I had the privilege of working with Dr. Blumberg in my first years at the Hepatitis B Foundation as an early career public health scientist. His mentorship had a deep and profound impact on my career trajectory, and I know that it has for so many scientists in the US and worldwide as well. From a global perspective, Dr. Blumberg was one of the very few people in history who truly changed the trajectory of humanity by saving hundreds of millions of lives. I want to thank the wonderful team at the American Philosophical Society for hosting us today at Ben Franklin Hall and for helping us to keep Dr. Blumberg's legacy alive. And the team at the Hepatitis B Foundation for putting this event together so flawlessly, especially Mara Delaney. Thank you so much. Today's event is being live streamed and recorded. After we conclude today, for those who are here in person, we invite you to join us for a reception after. And we also have an exhibit that we put together, the Hepatitis B Foundation, Blumberg Institute, and American Philosophical Society, with some of Dr. Blumberg's exhibit items, important pieces from his life. You can also learn more about the research being done at the Blumberg Institute and the public health work being done at the Hepatitis B Foundation. I'm happy to kick us off by introducing our keynote speaker today. It is an honor to introduce Sir Mark Thompson. Sir Mark is chairman and CEO of CNN Worldwide, where he oversees all aspects of the business in the US and around the world. He also serves as editor-in-chief of CNN. Sir Mark also serves as chairman of Ancestry, deputy chair of the Royal Shakespeare Company, and co-chair of the International Fund for Public Interest Media. He is the former president and CEO of the New York Times Company and former general director of BBC. Mark is an author of the 2016 book, Enough Said, What's Gone Wrong with the Language of Politics. He was educated at Stonyhurst College and Merton College, Oxford. He is an honorary fellow of Merton College, Oxford, and a member of the American Philosophical Society. Mark was knighted for services to media during King Charles III's birthday honors in June of 2023. In 1987, he married Dr. Jane Blumberg, Dr. Baruch Blumberg's daughter.
Okay, good afternoon, I want to say. Good afternoon, everyone. And as you've heard, you're beginning with a non-scientist, and kind of worse than that, a non-scientist who is, because I'm going to try and tell a story, will dabble in science. But I look around the audience and feel very confident because there are some incredibly distinguished scientists with us today. I also see Anna O'Connell, who worked for decades with Barry. So there are plenty of people to correct me and make sure you don't leave this getting the wrong impression about what happened. And I did know, as Barry's son-in-law and friend, I got to know Barry very well over many decades myself. And as you'll hear, amongst other things, spent a lot of time specifically walking with him. So let me begin my story. not at the beginning, but at the end, and right here. Those three portraits are hidden by the screen that you're seeing this picture on, but Barry's sitting in a chair just there. This is Barry as president of the American Philosophical Society, a role he occupied from 2005 to his death in 2011. He loved the APS. Barry he was an institutionalist, he loved institutions, he loved this institution, and all the friendships he had here. He loved the APS and its unique culture and place in this country's history. And there he is in his gorgeous Oxford academic gown, sharing the stage with three giants of the American Enlightenment, two earlier presidents of the APS, Benjamin Franklin, its founder or refounder, and Thomas Jefferson, its third president and the man who dispatched Lewis and Clark from this society to explore what would become the Western United States. And finally, one lowly APS member, George Washington, in many ways the founder of this country. Now, some of us might feel a little awed in that company, but as you can see, Barry doesn't look awed in the slightest. He looks at home. Barry never forgot that this country was founded not just by lawyers and business people and landowners, but by scientists and intellectuals, Enlightenment intellectuals, who saw the advancement of knowledge and reason as a central national mission. You won't hear any political opinions from me today, but I can tell you with some certainty that Barry would have been both dismayed and angered by the current turning away from science from some of America's political leaders, the defunding of research, and what he would have seen as the wholly unjustified and dangerous questioning of vaccine safety and much other science. Barry was a passionate believer in what he used to call the technical fix, by which he meant the systematic use of inductive and deductive reasoning to solve challenges, not just in science, but in society. And he saw the technical fix as a particular American strength that didn't just confer a vital competitive advantage on this country, though he was a capitalist and he thought he did just that, but also something which could benefit the entire world. And he would have regarded the current hostility to it as an act of national self-harm. In this commitment to practical knowledge, of the three gentlemen behind him on the wall in this picture, he's probably closest to Franklin, with whom he also shared an intense pride in Philadelphia and a polymathic interest in every kind of knowledge and culture. But he was perhaps a little less willing than Franklin to divide knowledge cleanly between the useful and the abstract. Take his own critical field and lab work, gathering and then trying to understand polymorphisms. You'll hear that a lot, I think, today. In other words, naturally occurring inheritable genetic variations in human and animal populations. Quote, the study of inherited variation was basic, non-goal-directed research designed to illuminate a natural biological phenomenon, he says in his book, Hepatitis B, The Hunt for a Killer Virus. But then he goes on, quote, in medical research, or for that matter, any form of fundamental research, there is a belief, one might even say a faith, that knowledge and understanding, although not immediately useful, will, in the end, lead to practical application. And so it proved in his own case. But let's now turn to the real beginning. Baruch Samuel Blumberg was born in Brooklyn 100 years and 1 day ago, on the 28th of July, 1925. And here he is at about age 5, with his parents Ida and Maya, his sister Miriam, and his brother David. Now, the funny thing about this picture is I don't have to tell you which of the children is Barry. He's clearly already the center of attention, and as my beloved wife, his daughter Jane, notes, already apparently sitting on a pedestal. You can actually see at the bottom of a small child on a pedestal behind, but Barry's on one too, at age 5. Barry was intensely proud of his family and his Jewish heritage. The first school he attended was the Yeshiva of Flatbush, where, as well as the 3 R's, he began to learn Hebrew. And in a long life, he never lost his love for the Jewish Holy Scriptures or his respect for the never-ending spiritual and intellectual challenge of interpreting them. He himself interpreted a couple of verses in Genesis 2 as a divine foundation for science itself. Quote, "And the Lord God formed out of the earth all the wild beasts and all the birds of the sky, and brought them to the man to see what he would call them. And whatever the man called each living creature, that would be its name." And to Barry, this naming of the animals was the start of the process of discrimination and categorization by observation with which our understanding of the natural world began. Later, Barry attended the James Madison High School in Brooklyn. Then in the early 1940s, when the family moved to Far Rockaway, he switched to the Far Rockaway High School, an academic institution that produced no less than 3 Nobel Prize winners, of whom Barry was one, Richard Feynman another. It was clear to Barry early on that science would be his vocation, and initially, like many of his contemporaries, he set his sights on particle physics. But then the Second World War intervened, and Barry enlisted in the US Navy. And here he is, by the summer of 1945, not just a deck officer, but at the age of 20, the commander of his own vessel. I think a fairly small landing ship, but in command, and facing the very real prospect of being sent across the Pacific to take part in the invasion of the Japanese home islands, had not the atomic bombing of Hiroshima and Nagasaki brought that conflict to an end so that he could return to his studies. But in 1946, he graduated from Union College, Schenectady. I probably spoke Schenectady. I always get those ones wrong, sorry, despite having become an American. And he took up graduate studies at Columbia, first in mathematics, but then crucially transferring to medicine, a switch which set the course for the rest of his life. He graduated from the College of Physicians and Surgeons there in 1951 as an MD. And in the 1950s, continued his medical training and also undertook graduate studies and research at the University of Oxford, earning his doctorate at Balliol College in 1957. So biological sciences and medicine it was. And perhaps this is a good moment to discuss what kind of scientist Barry Blumberg would turn out to be. Barry was an adventurer, an explorer who'd already taken every opportunity he could to escape the safety and familiarity of his Brooklyn childhood and youth to discover the wider world and all its peoples. By the early 1950s, he'd not only served in the military, but had helped crew a sailing boat on a hair-raising and storm-tossed passage from Holland to Lisbon, and spent time in the nascent but still very tense new state of Israel. In science, his 2 great heroes were 2 scientist explorers, Humboldt and Darwin, colossuses for whom the process of discovery began not with theory, but with the closest possible observation of nature in the field. For them, the forming of hypotheses and the systematic testing of those hypotheses came after the original encounter with nature. One corollary of this approach was that in an age when the majority of research scientists were already specializing very early in their careers, and that trend would intensify in the decades to come, Barry instead aimed to be guided in his ultimate research target by what he observed and discovered. And so he put his boots on and headed out into the world. And there he is. Early on in a quest that increasingly focused on those genetic variations, polymorphisms in the human population, gathering samples, but also meeting and talking to and trying to understand different communities and different continents and cultural settings, from urban and suburban America to jungle and savanna, from Suriname to Australia. This is the scientist not as lab rat, but as Indiana Jones. And here, brought them, are a pair of work boots. And we think probably, it's quite hard to tell actually, but probably the very boots in the photograph there. And if you want to come and feel them afterwards, you'll see they've had quite a lot of wear. And indeed could do with a polish. He was a great polisher of shoes actually. And they're only one of many pairs of boots worn out in a lifetime of walking and listening and talking. Barry loved to walk and watch and listen and converse. And even what was meant to be downtime, he'd never be in an armchair for long, but it was by the door putting on his boots or his bicycle helmet. In winter, he'd put it on over a thick woolen bobble hat, which he then pulled very tight under his chin with a chin strap, which must have kept him very warm, but also gave him a somewhat frightening look. And when I think of him, I think of him like that, out and about, walking and talking. I remember very clearly my daughter, who can't be here today, Emily, aged probably no more than 6 or 7, being taken by Barry out into the Maine woods to study wild animals and insects and flora and fauna. And by the time she was 7 or 8, they, together with some other friends, started assembling a botany of the summer home. Something Emily never forgot, and she had shared a little bit of that instinct. She's now just beginning her 2nd year as a fellow in hematology oncology, so that it's stuck in that case. But we walked everywhere. And Barry himself, in other settings, walked with an Irish friend around the streets of Dublin, in the footsteps of James Joyce's Leopold Bloom. He was a great lover of Joyce and Ulysses. Later, once he won his Nobel Prize, he met Saul Bellow, I think won the Prize for Literature in the same year, and Saul Bellow would take him on walks around Chicago, the city that Bellow had made his own. I walked with him from one side of England, the Irish Sea, to the North Sea, the other side, the coast-to-coast walk in England. We walked with other family members along the Sentiero degli Dei, the path of the gods, high above the Amalfi Coast in Italy, over endless favourite stretches of the Appalachian Trail in Maine, and many other places as well. But from the time of this photograph onwards, there was a lot of walking, as well as flying and journeys and jeeps and trucks and goodness knows what, as well as a lot of bench science in Barry's professional life. At Oxford University, as well as America, he worked with colleagues to collect and analyze variations in polymorphic serum proteins in Basque, European, Nigerian, Alaskan populations, amongst others. Serum, I'm sure most people here know better than I, is the fluid clear element in blood. And by the, he says this in the Nobel Prize lecture, by the late 1950s, Barry said he was acquiring, quote, some skill in mounting field studies. And they were discovering new polymorphisms in both animal and human populations. In that lecture, he says, quote, from these studies and from those of other researchers, the richness and variety of biochemical and antigenic variation in serum became strikingly apparent. The startling progress was a triumph of collaboration, both within the teams with which Barry was first a member and then a leader. He always stayed very close to his fellow team members through life, both when he was working with them and afterwards, and some, as I've said, are here. But also collaboration between different teams in different countries, sharing samples, sharing ideas, and with many gifted new colleagues who were exploring this burgeoning field. Among those was Harvey Alter, who you're going to be hearing from shortly, at the time a brilliant hematologist who came to work with Barry and his colleagues at the NIH, which was where Barry was working from 1957 to 1964. Harvey went on to receive a Nobel Prize for his own groundbreaking contribution to medical and biological science, and specifically the discoveries that led to the identification of the hepatitis C virus in the 1980s. But I'm going to turn briefly now to the crucial discovery 2 decades earlier that Barry himself is most associated with, and which I'm sure will be discussed in more detail as we go, which opened up the whole field of viral hepatitis and led both to the discovery of the disease that became known as hepatitis B, and, as Shari's already mentioned, the development of a vaccine against it. It began when they first came across something they later named the Australia antigen. An antigen, again, for the few people here who may not know, is a substance, often I believe a protein or a sugar, that triggers an immune response in a human or animal immune system. The moment's captured in this famous photograph, which I took from Barry's book. Barry and his team were at this stage systematically testing sera from patients who'd received many blood transfusions, their hypothesis being that these patients might have developed antibodies against antigens, not that they themselves had inherited, but which had been introduced into their systems through the donor blood they'd received. One of their motives for doing this research was the hope that through the discovery of antisera from these patients' bloods, they might be able to identify totally new antigenic polymorphisms. So that was, in a sense, in their minds as they were doing it. And this photograph, which is one of Harvey Alter's experiments when he was working with Barry, shows just this happening. Forgive me if I get this wrong, but the two circular wells, two circles in the picture, contain sera from two individuals. The lower from a hemophilia patient who'd indeed received many blood transfusions, the upper from a patient with leukemia. The arc, it's a very distinctive arc, like an eyebrow, or crescent in the middle of the photograph, represents the reaction between the two sera, which is the result of antibodies in the serum from the lower well reacting to something in the serum in the upper well. Now, the shape of that crescent, that reaction, was both distinctive and novel. It hadn't been seen in experiments with hundreds of sera from the general US population, but it would be found in due course in experiments with sera from Taiwan, Vietnam, Korea, the Central Pacific, and yes, from Australian Aborigines. The fact that the lab had so many samples from Australia, some of which provoked this novel reaction, was the reason why Barry and the team chose the name Australia for their new antigen. So they had a name, but didn't yet know much about what it was or what its significance, if any, might be for human health. And discovering that would, like any great detective mystery, require many more clues. I'm not going to go through all of them, but first of all, here's Barry on what was happening at this stage. Quote, a series of background events led to the generation of the hypothesis that Australia antigen was connected to hepatitis. In research, important ideas do not often spring up in isolation, like Aphrodite, very Barry this metaphor, like Aphrodite suddenly rising from the sea, incompletely clothed and served up on a scallop shell. Usually a lengthy period of observations and ideas forms a background of knowledge. Darwin, for instance, Darwin's concept of evolution did not come in a sudden, insightful flash. In this case, the period of observations and ideas did indeed take some time. It turned out that although the Australia antigen was rare in normal populations, especially Western ones, it was more prevalent in one group, patients with leukemia who'd received transfusions. That prompted what Barry called the susceptibility hypothesis. Was there a common susceptibility factor that made it more likely both to have the antigen and to develop leukemia? Or could the antigen itself be related to an infectious agent, say a virus, that directly caused the leukemia? One group the team started focusing on were young Down syndrome patients, because they knew that this group was much more likely to develop leukemia than other children and young people, and also because they were a group who could be identified and studied locally. By the middle 60s, Barry was Philadelphia-based at the Fox Chase Cancer Center, and so they arranged to admit Down syndrome patients for study in the clinical research unit of a partner hospital. In general, the presence of or absence of the Australia antigen seemed to be a consistent feature of an individual. It was either present or absent in multiple tests. However, in early 1966, one of these Down syndrome patients, his name was James Bear, who'd been antigen negative in the first test, was tested again and now found to have the antigen. Again, let me quote directly from Barry's own account. There was no obvious change in James's clinical status, but because he'd apparently developed a, in quotes, new protein, and since many proteins are produced in the liver, we did a series of liver chemistry tests. These showed that between the first testing and the subsequent testing, James had developed a form of chronic hepatitis. This striking finding in a single patient prompted a further but yet unproven hypothesis, namely that the antigen was associated with acute viral hepatitis. And over time, the team was able to gather more and more evidence of a link, and by the end of 1966, Barry and his colleagues had enough confidence to publish a report that stated, quote, "The discovery of the frequent occurrence of the antigen in patients with viral hepatitis raises the possibility that the agent present in some cases of this disease may be Australia antigen or be responsible for its presence." This paper triggered research by other teams around the world, and the link between the antigen and hepatitis was further substantiated by multiple studies relatively quickly. I want to add just one side note at the time. In this era of science, sometimes, unfortunately, scientific and clinical researchers would treat patients and subjects and population groups with a lack of humanity or respect, or treat them merely as a means to an end. Barry and his colleagues always tried to establish relationships of partnership and respect with those they worked with. He was often able to help the communities who gave him samples of blood, help them with other health issues, and in the case of James Baer, developed a continuing relationship both with that patient and his parents and the rest of his family. It's a real mark of the way Barry was a doctor, and he never forgot that doctors have patients and you treat patients with respect. Given what was now recognized as the high probability that donor blood containing the antigen was much more likely than blood that did not transmit hepatitis, and the fact that it was possible to screen blood shortly for the antigen, Barry and his team quickly moved to exclude individuals with the antigen from blood donations in the hospitals where they were working. By 1969, they developed an assay to detect the presence of the antigen in blood, and the practice of screening for the antigen quickly became established across America and the world. This led to novel new ethical dilemmas, some of which were harbingers of the AIDS crisis of the 1980s and 90s. If a health worker's blood turned out to contain the antigen, for example, should or shouldn't they continue to work with patients? For Barry, this was an example of what he called in a later paper written with the sociologist of clinical research, René Fox. He called it the Daedalus effect, after the great artificer of Greek legend. Each discovery or invention to solve one problem creates a new question or challenge or problem of its own, and the process never ends. This collaboration with René Fox, by the way, is a good example of the sheer breadth of Barry's own interests, which spanned disciplines and extended into culture, theology, and the history of ideas, though always, in Barry's case, with that bias towards the particular and practical rather than the purely abstract. The story of Barry and hepatitis has many more chapters, which I won't cover in detail. Above all, of course, the ultimate development of a vaccine against hepatitis B, which was approved by the FDA in the 1980s. By the year 2000, an estimated 1 billion doses of this vaccine had already been administered worldwide. I'm sure we'll hear several estimates today, but it's very difficult to quantify the full global impact of the vaccine. But I did see one paper from the CDC last year which estimated the vaccine would save 38 million lives amongst people born between the year 2000 and 2030 in 98 low and middle income countries, and between 2001 and 2020 save $120 billion in costs in very hard-pressed health systems in 73 low and middle income countries. Well, as I think everyone knows, global recognition had arrived even before that vaccine was available. Here are Barry and his youngest son, who spoke in Doylestown yesterday, Noah, rather younger Noah, at a celebration in Philadelphia immediately after the news had arrived that Barry would be a co-recipient of the 1996 Nobel Prize in Physiology or Medicine for his work on what had turned out to be the hepatitis B virus. The Nobel Prize was notable, the most notable of many awards and honors bestowed by many institutions in many countries. As Chari mentioned, from 2010, World Hepatitis Day, which had been founded by the World Health Organization and the World Hepatitis Alliance, was moved to July 28th, yesterday, in honor of Barry's birthday. And so we marked that day yesterday as well. Here is Barry later in life at the Fox Chase Cancer Institute in Philadelphia, where so much of this groundbreaking work had taken place. But in 1992, he participated in the founding of the Hepatitis B Foundation in Doylestown, Pennsylvania, dedicated to finding a cure for the disease and liver cancer. The foundation itself then established the Baruch S. Blumberg Institute, an organization that focuses on research into Hep B and related diseases and the development of diagnostics and therapeutics aimed at curing hepatitis B and other severe viral diseases. Barry supported this work wholeheartedly for the rest of his life. You heard that Sharon had a chance to work with him in that period. And yesterday, these institutions marked his centenary with a celebration of his life and work in Doylestown. And I'm sure you're going to be hearing more about that from Tim Block and others later on. But there was much, much more besides. Barry had a multi-decade association with my own alma mater, the University of Oxford, and in 1989 he became the first scientist, the first American, indeed the first non-Brit, to become a Master of Balliol College there. Then in 1999, by now in his middle 70s, Barry became the founding director of NASA's new Astrobiology Institute, a venture with a mission that Barry always thought should win some kind of prize for ambition. The mission is to understand, quote, the origin, evolution, distribution, and future of life in the universe. You can't imagine Barry Blumberg saying no to founding that. And finally, as you've heard, he became president of this great society, the APS, in 2005. But in many ways, I've left the best to last. Here is Barry with his wife, Jean, in later life. They'd met in New York when Barry was at Columbia and Jean was working at the Sloan Kettering Institute, and they married in 1954. Of all the many teams that Barry was a part of in his long life, this was the most important to him and the most enduring. Jean was a painter of great talent and a supporter and partner in so many of the endeavors I've listed this afternoon. Although she died 2 years ago, some 12 years after Barry himself, she remains, as he does, a well-remembered and much-loved presence in so many places. Here at the APS, in the Hep B Foundation and the Blumberg Institute in Doylestown, in Society Hill, right here in Philadelphia, in Rangeley, Maine, where Jean and Barry had their summer home, in Oxford and England and London, and many other places besides in every continent of this planet. And to those who knew them, it's impossible to think of Barry without Jean, or believe that he could have achieved what he did without her. More than anywhere, they're still honoured and missed in the Blumberg family by their 4 children, Anne, George, Jane and Noah, their 9 grandchildren, and their other relations, and the many, many personal friends they made, some of whom, of course, were professional colleagues as well, and some of whom, maybe many of whom, are here today. Barry died on April the 5th, 2011, just after he delivered a talk on a return visit to NASA Ames to meet and discuss science with dear friends and colleagues at NASA. So he died much as he'd lived, doing science, curiosity undiminished, full of questions yet to be answered, full of zest, and with his boots, those boots with which he'd walked so far and discovered so much, still very firmly on. Thank you.
I love Barry. I met him in 1989 when he joined the Glycobiology Institute. I enjoyed every minute we were together, but we never seemed to have enough time. It was marvellous to travel with Barry. On walks, he would stop and point out almost every tree we passed. He knew so much. He could talk to anyone about anything. We shared many thoughts about our families and about each other, thoughts which I've never shared with anyone else. I've never had such a great friend as Barry. Barry believed in inductive, rather than deductive research. His Nobel Prize was a direct result of this philosophy. He'd travelled the world, far and wide, collecting serum samples, which eventually led to the identification of the hepatitis B virus and the subsequent development of the vaccine. Barry was very much an explorer and pioneer, like two of his heroes, Lewis and Clark. As Shakespeare says, his life was gentle, and the elements so mixed in him that nature might stand up and say to all the world, this was a man.
Charlie Rice here. I wanted to say a few words on the occasion of Baruch Blumberg's centenary celebration. He was really quite a remarkable scientist and human being. And I'll never forget this interview quote that I found, and that Barry said. He said, "Saving lives," he said, "was the whole point of his career." Well, it is something that I always wanted to do, he said. This is what drew me to medicine. There is, in Jewish thought, this idea that if you save a single life, you save the whole world, and that affected me. So I wish that all of you a sort of a fantastic celebration of this remarkable individual, and hopefully in another not too distant future celebration, we can celebrate a better way of actually curing chronic hepatitis B.
Thank you so much, Mark, and also thank you to Raymond and Charlie as well. It is now my absolute honor to introduce our next speaker. Dr. Harvey Alter is a virologist known for his significant contributions to the discovery of the hepatitis C virus. He was also part of the team, as you heard, that worked on the discovery of the hepatitis B virus. His work, particularly his research into transfusion-associated hepatitis, led to the development of crucial blood donor screening programs that have drastically reduced the incidence of transfusion-transmitted hepatitis. He basically helped to make our blood supply safe in the US. He was awarded the Lasker Prize in 2000 and the Nobel Prize in 2020, along with Michael Houghton and Charles Rice for their joint discovery of the hepatitis C virus. Dr. Alter?
Thank you, Sherry. Excuse me. Barry was actually my first research mentor and became a good friend for many years while he was in Washington or Maryland. Jean, his wife, who hosted me at many dinners, but also I was single at the time, and she was always trying to fix me up with a nice Jewish girl. Now, I'm not a member of the American Philosophical Society, but I'm on the list to be inducted into the Ridgewood Queens Philosophical Society, where I grew up. In Ridgewood, Queens, I think I was the only one who ever went to college, so I have a good chance of getting in. Now, Mark has shown you, we're overlapping in our talk, but perhaps I'll give you a little bit different spin. But his showing of Barry's boots, which are also one of my pictures, reminded me of the adage that we know that before you get angry with someone, you should walk a mile in their shoes. Because then, when they get angry back, you're a mile away and you have their shoes. Now, let's do a slide here. So this debonair chap, there's going to be some overlap in our pictures, but this is a youngish Barry Blumberg. At this point in his life, he was trying to decide whether he should go to Hollywood with his good looks and win an Academy Award, or stay in science and win a Nobel Prize. Now, had he gone to Hollywood, we would not be here today, so I'm glad he made the right choice. This is Barry's family, as you see, with his parents and his siblings. And Mark made the observation that here he is already on a pedestal. I was struck by his erect posture, his straight-looking eyes, and especially his socks, which predetermined his future greatness. Now, Barry came up in a somewhat privileged childhood. And here he is with his similarly dressed pony on their daily trot to school. I love that picture. Now, here's the chronology. I didn't know Mark was going to go through this, but this is just a linear chronology. Barry was born in New York City in 1925, attended Orthodox Yeshiva University of Flatbush, where he often snuck out to watch the Brooklyn Dodgers, as I did, my great thrill of my childhood. In 1943, he enlisted in the Navy, and he basically turned the tide of World War II. In 1946, he got his BS in physics at Union College. Interesting that he began with physics. Then he did graduate work at Columbia. He studied math and physics again, so he was on a different track when he suddenly switched to medicine. And Barry said that was by strong urging from his father, that when chronic, people were different and people's responses were different. And that really was the focus of his career, was he's inherited perhaps differences in people and in serum proteins. In 51-53, he did a medical residency at Bellevue, where you really learn medicine, I'll tell you, at Bellevue. And then he did a fellowship in arthritis at PNS. And finally, in 54, he marries his classmate, Jean Lieberman, has 4 children. We're blessed with Jane here today and her family. So I met Barry in the early 60s. I was a young NIH fellow. Had neither a project nor a mentor, really. I was on my own, and I had to come up with a project, and I decided to look into inherited differences in serum proteins that might be the result of transfusion reactions. People get fever and chills after transfusion. We knew they happened from red cell incompatibility, white cell incompatibility. And I said, well, maybe they also happen from plasma protein incompatibility. And I used aerogel diffusion, which you just saw, and looked for antigen-antibody reactions that would result in that precipitin line that Mark showed you. One day, Richard Astor, who became a very famous platelet immunologist, but was in the blood bank with me at that time, he said, I heard this interesting lecture by a guy named Baruch Blumberg, and I'd never even heard the name Baruch except in Hebrew school. And he said, he's doing pretty much the same thing you're doing. You ought to go talk to him, which I did the very next day. Met with Barry. He was very approachable, very easy to talk to. In fact, he talked a lot. He was a very chatty guy, could talk on any subject. But we hit it off, and we set up a collaboration. He had these serum samples, and I had the patients at NIH that I could follow. And we just established a collaborative project, which in those days, in the early 60s, was very easy. You had no approvals, no nothing, no protocols. You just did what you wanted to do with NIH. Oops, I'm sorry, I went to the wrong slide. There we go. So Barry, as you've shown, loved to trek the world. His interest was in looking at indigenous populations throughout the world, collecting samples. We had freezers full, a whole floor of freezers full of samples from all over the world. And Barry loved that. He spent more time on the road than he did at NIH. But when I met him, he'd already found a polymorphism, a difference in serum beta lipoproteins. These are the lipoproteins that carry cholesterol, carry other lipids in the blood, very important. And he found that some people had different beta lipoproteins than others. And characteristically, those precipitin lines, which were white, turned blue with a lipid stain. So I was doing these tests for these polymorphisms when one day the line didn't take up that lipid stain. Instead, it turned red for a counter stain for a protein. So Mark, it was more the color of the line than the curve of the line that determined this reaction that was different than the beta lipoproteins. It turns out that in one well was this blood from plasma from a hemophiliac patient, been transfused innumerable times. Thus, it had many, many exposures to other people's proteins. And by chance, in the other well was an Australian Aborigine. Now that could have been a Philadelphia African American. It could have been a Suriname patient. It could have been anything from anywhere in the world. Just that particular day, by chance, we were looking at Australian Aborigines, found this red antigen. In fact, the first name for it was the red antigen. That's what we called it. Then we thought maybe we should call it the Bethesda antigen because of the place where we found it. And Barry said, no, they're naming hemoglobins by the place where the patient came from. And that's how it got the name Australia antigen. So my first job then was to look at patients in the clinical center at NIH, as well as the samples that Barry had. And this was instructive in that we had found that this antigen was present in 10% of Australian Aborigines. But when I looked at healthy blood donors, it was only 0.1%, 1 in 1,000. When I looked at other diseases besides leukemia, it was also very low, 0 to 1%. But in leukemics, it was 10%, very high. So Barry, who was always hypothesizing, he had this wall chart in his office of, this is my hypothesis, this is how it turned out, it wasn't right, this is what we did next. And the whole wall had this chart in it. So he started hypothesizing about this, why leukemics? His hypothesis was wrong, but it led to the right answers. He thought as a geneticist that this would be a gene that predisposed one to leukemia. In fact, the first paper published in JAMA was a new antigen in leukemia serum. And we even postulated in that paper that this might be a part of a leukemia virus. People thought then, and maybe still now, that leukemia could be due to a virus. But that was that first link to leukemia. People ask, who's Sam Bisnick, the third author in that paper? Sam was a technician in a lab who very shortly thereafter left the lab and became a commercial airline pilot. So now we got this link with leukemia. So then Barry comes up with this idea. Well, if this is genetic and it predisposes to leukemia, let's look at another disease that has a genetic predisposition to leukemia. And that is patients with Down syndrome, formerly called Mongolism. So we studied patients with Down syndrome And by this time, he left NIH. He was in Philadelphia. And Tom London, Linda London's here. Tom London was very instrumental in these studies. They found a high prevalence of the Australia antigen in patients with Down syndrome. So it looked like this had confirmed his hypothesis of a genetic relationship to both leukemia and Down syndrome. But he did another experiment that was crucial. He looked at Down's patients in different environmental settings. And he found that if you were in a large institution, which many of these patients were, that they had a 28% antigen positive rate. But if they were in small institutions, it was only 3%. If they weren't institutionalized, they were home with their parents, it was 0%. And if they were newborn, it was 0%. So this was not genetic. This was a function of the environment. Living in crowded conditions, unsanitary conditions, as these institutions were. So this suggested not an inherited disease, but an acquired disease that was dependent on the environment. So that was the first clue that it might be an infectious agent. So this was a very critical study. So getting on to the chronology, in 57, 64, he was at NIH at that time, and that's where the discovery of the Australia antigen occurred. In 62, he meets Alter and almost decides to give up research. But then he moved to the Institute for Cancer Research, Fox Chase Center, in 1964 to 2011. So the rest of his life, he was there. In 1969, he got a patent for a hepatitis vaccine based on purified Australia antigen. Now, he had not shown at that point that the vaccine worked. It was a sort of a hypothesis that it would work because there was a huge amount of antigen easily acquired, and was able to get the patent. It was kind of controversial. Could you get a patent on an idea rather than a demonstration? But he got it, and that vaccine became very, very important. In 1976, he received a Nobel Prize with Carlton Gajdusek, who had nothing to do with hepatitis. Gajdusek had discovered basically prion disease, mad cow disease in Borneo. Our disease was transmitted by blood from natives rubbing the blood of the dead father, or inoculating the blood of their dead father. But Gajdusek was another interesting but totally distinct Nobel Prize. In 1989, as Mark told you, became Master of Balliol College in Oxford. He was the first American to ever hold a chair at Oxford. He told me, I said, well, what did you really do there? He said, well, I had no power, but I had great influence. And I think that was true. In 1994, he went to Stanford University. He was teaching medical anthropology. The diversity of his life is more than the polymorphisms in patients. And then he became the director of astrobiology. And Mark said, looking for life in space, really, which still hasn't been found, but he's now up in space, still looking for that life. 2005, he became the president of the society, and in 2011, he died. In 2011, he died at age 85, and he had just given this lecture to NASA. So he really died with his boots on. He was still in science, went back to his hotel room and died. This is a picture of Hippocrates, the father of medicine. I show that because the great similarity between Hippocrates and Blumberg. Hippocrates had glasses, which had not yet been invented. and Blumberg had a beard, they would be almost identical. So in a tribute to Barry, I once wrote that Barry was a complex, brilliant, imaginative, adventurous, tenacious, and dedicated. He was a deeply philosophical man of eclectic interests and myriad accomplishments. He was a Nobel man. So thank you very much. It's a pleasure.
Dr. Blumberg is remembered by his discovery of hepatitis virus and the invention of the vaccine to prevent the virus infection. As a colleague of the Dr. Blumberg at Fox Chase Cancer Center in 1990s, I fortunately had his guidance and encouragement in my early research career. Now, as the president of Baruch Blumberg Institute, cure of chronic hepatitis B is our primary goal of research and drug development. I believe the best way to celebrate the life of a great scientist, physician, and mankind, Dr. Blumberg, is to eliminate hepatitis B virus infection in humans, which is currently on the way.
When I first met Dr. Blumberg was in the summer of 1971. I myself, having finished 3 years pediatric oncology fellowship, I needed a staff position in Philadelphia, but there was no opening. I found Dr. Blumberg's name in Institute for Cancer Research. So I flew to Philadelphia, met Dr. Blumberg. At the end, he suggested he would create a position as a temporary research physician. Well, that research physician appointment went 2 more years extension, then indefinite. So I ended up staying with him for 17 years, enjoying every day. He has been one of the best mentor, helped my early career, and good colleague, teacher, and very close friend. I owe him a lot. Thank you.
Good afternoon. My name is Michelle McDonald, and I am the director of the Library and Museum here at the American Philosophical Society, and it is our pleasure to co-host this afternoon's event. Also my pleasure to moderate the upcoming panel. And as I introduce the members of that panel, I invite you to join me on stage. Dr. Timothy Block is President Emeritus and co-founder of the Pennsylvania Biotechnology Center, Hepatitis B Foundation, and its research arm, the Baruch S. Blumberg Institute. He is a scientific co-founder of several life science companies, co-inventor on 22 issued patents and 23 applications, and has authored more than 270 scholarly papers, as well as 2 books. Dr. Jane Blumberg is the daughter of Baruch Blumberg and grew up in Philadelphia. She was educated at Cornell University and received a PhD at Balliol College at Oxford University. Dr. Sherry Cohen is president of the Hepatitis B Foundation. She conducts research and implements programs to reduce health disparities and improve health outcomes associated with hepatitis B, hepatitis D, and liver cancer. Dr. Cohen served on the 2024 World Health Organization Guideline Development Committee for Hepatitis B Management and Treatment. And already up on stage, Dr. Walter Su is a nationally known consultant on public health and healthcare reform. He is the president of the Philadelphia County Medical Society and is a retired adjunct professor of family medicine and community health at the University of Pennsylvania, where he taught community health at their Center for Public Health Initiatives. He is a past president of the American Public Health Association and former health commissioner of Philadelphia. This is your panel. My first question is for Dr. Block. Dr. Block, can you share the story of how you came to know Dr. Baruch Blumberg and his role in starting the Hepatitis B Foundation?
Oh, well, thank you for the question. It's an honor to be up here. You know, that's a wonderful memory, and I could go on a very long time reminiscing about that, but I'll be very brief. So, you know, we wanted, I decided in 1980, 1990 to start studying the hepatitis B virus. We wanted to work on a cure for hepatitis B virus. So who to do that with? Baruch Blumberg. So it turned out he was, I thought he was in Philadelphia. It turned out he was in Oxford. So I contacted him, invited me to come and spend a sabbatical year there. At that time, my wife, Joan, and I, and Jan and Paul Whitty were deciding to start a new foundation, the Hepatitis B Foundation. And he was very eager to help us do that. And yes, hear about all the walking, there's a lot of walking involved. Some of the places we first walked to, I want to just point this out, was before we started the foundation, was we went to present the idea of working on a cure, finding a cure to hepatitis B, to various pharmaceutical firms. And because of Dr. Blumberg's prestige and stature, we got into see the leadership at many of these companies, but none of them actually wanted to work on a cure for Hep B. The market wasn't there. In those days, the market wasn't there.
The next question is for you, doctors. Dr. Blumberg was involved in development of the first hepatitis B vaccine, as we've heard, which is also the first anti-cancer vaccine because it prevents liver cancer. The vaccine was recommended universally for babies and children in 1992, when you were the health commissioner of Montgomery County. Can you talk about the adolescent catch-up vaccine program that you led, and that program linked you to Dr. Blumberg, and how that program linked you to Dr. Blumberg and the Hepatitis B Foundation?
Well, thank you for inviting me. This is a story about a new health department, a young couple interested in public health, and an intrepid newspaper reporter. In 1990, we started the Montgomery County Health Department in Pennsylvania. If you're not from Philadelphia, you should know that Montgomery County is one of the neighboring suburbs of Philadelphia. At the time, it was the third largest county in Pennsylvania, and it was the largest county in America without a health department. So we had a daunting task ahead of us. There was a young couple living in Montgomery County at the time who were very interested in the travails of creating this health department. And they were a couple called Joan and Tim Block. And Joan, being a persistent person, actually wanted to talk to me about hepatitis B, which I thought, well, I didn't know very much about it. But she invited me, and I finally agreed to come over to their living room. And there was a group of families talking to me about hepatitis B. And what they were telling me was quite heartbreaking. They told me that they had families whose kids were actually being discriminated against because it's hard to hide the fact that you might have hepatitis B. You know, kids get nosebleeds or they cut themselves. And the word spread quickly that, you know, maybe this kid had hepatitis B. And people would not sit next to the kids in school buses. Kids wouldn't eat with their children at the school lunches. And it was really becoming quite a problem. This is, I should tell you, right before the hepatitis B vaccine was announced. But at sometime right around that time, just maybe a year later, Merck came out with a vaccine called Recombavax, which was a very effective hepatitis B vaccine. And, you know, the idea of maybe doing a catch-up program occurred to all of us that this might be an opportunity where we could actually do something for the school kids and change sort of the nature and stigma that was around hepatitis B. So I remember talking to one of the newspaper reporters about some of my ideas about what we would like to do in the future at the Montgomery County Health Department, and one of them was to do this catch-up program for Hep B. But as the new health department, we were already straining the budget of Montgomery County, and we were told, do not ask for any more money. So we went to the budget hearing. Now, there was this intrepid newspaper reporter who had heard the story that I had mentioned before about Hep B and catch-up, and she was like every good local journalist, which unfortunately is sort of a dying breed in America today. She would go to all the budget hearings for all the departments. And when the health department came up, she came to the hearing, and her name was Peggy Gibbons. She worked for the Times Herald in Norristown, and she said, she heard the presentation, and the commissioners kind of heard our budget and then said, is there anything else you would like to do? And she said to me, what about that program for vaccine that you were talking about earlier? And the commissioner said, what are you talking about? So then I explained this hepatitis B catch-up program, and she said, and she had her pen in her hand ready to write down what he was saying. He said, how much is this going to cost to run this program? I said, well, I don't know, maybe $30,000 to buy the vaccines. We would administer it. It was a company, Merck, that was in Montgomery County, so we would be helping a Montgomery County business. Well, that really was a smart thing to say, let me tell you. And he heard that, and he said, well, why don't we do that? So it was her question, really, the fact that she asked that question, and she was ready to write something about it in the paper that allowed, I think, us to get the additional money to pay for the hepatitis B catch-up program. The idea, of course, was that we would go to the middle schools, we would give every year, 1 year after another, the hepatitis B vaccine to every middle school in Montgomery County. And then we also knew there was the birth cohort of people who were getting the initial birth vaccine. And each year, as the kids who were birth cohorts finally became middle school students, we would actually have completed the entire program, and we would have caught up and allowed changing the equation or the feeling about what hepatitis B might mean in Montgomery County. And I think actually today, as we see, it has changed our thinking about and the stigma and discrimination that came with hepatitis B because of the vaccine that Dr. Blumberg helped put together. So that's my comment.
Dr. Blumberg, the third question is for you. Your father spoke often about how he appreciated your work with him on editing his book, The Hunt for a Killer Virus. Although he had an editor at Princeton Press, he especially valued your thoughts and insights. As a daughter and a professional writer yourself, what did you learn about your father while working with him on his memoirs?
Well, as kids, we thought he was a slightly mythological figure and quite, swashbuckling, as some of the photographs suggest. And it was working on the book with him and actually rereading it recently. Actually, he was very methodical and very thoughtful and a great planner. But he was also the other thing. He was also a great storyteller and huge fun. I mean, he was just loads of fun to be with, and he was a great father. But the kind of adventure and the planning and the caution, it really struck me that that's actually also who he was. And he had this idea about science, and he talked about it a lot, that you don't focus on a particular goal, and that it's important to observe the whole world in a kind of general way. Also, that was an excuse to get out and go. And he read lots of adventure stories when he was a kid, King Solomon's Mines, and he wanted to really explore the world. And that part of him, and the kind of tension between the being driven as a scientist and his impatience to get things done, that was sort of who he was, and that came out in the book pretty powerfully. And I did urge him to try to talk more about himself, which he really was reluctant to do. He wanted to stick to the science, and I think I prevailed, as well as the editors at Princeton University Press, to bring himself actually into his own story. So, but rereading it, I think he did that. It's a good read.
Dr. Cohen. Dr. Block talked to us about the formation of the Hepatitis B Foundation. Can you talk about the public health and community work that the Hepatitis B Foundation has conducted here in Philadelphia?
Yeah, yeah, sure. So in the early 2000s, it became abundantly clear that most people in the U.S. who had hepatitis B hadn't been diagnosed or tested. And vaccination rates were really low. And we started to talk to people and realize that there were a number of challenges towards diagnosis, including stigma, low awareness among communities, low awareness among healthcare providers and healthcare systems. And so we figured the best way to work on hepatitis B in Philadelphia was to go into communities. And so luckily, we have some co-founders in the room. So we started in 2008 a local coalition called Hep B United Philadelphia. And so it was co-founded by Joan Block, Dr. Gong Chen, who went on to the FDA after that, and Walter Su. And we basically spent 2 years knocking on doors of local community leaders and healthcare providers in the Asian communities in Philadelphia and the African immigrant communities in Philadelphia and said, here's what's going on, can you help us? And we spent, from 2008 till now, spent dozens and dozens of weekends and evenings going into communities, into church basements and restaurants and local clinic sites, even social service fairs, cultural festivals. People would roll up their sleeves and we would offer free screening, free education, culturally competent, linguistically competent education and awareness, working to break down stigma, working with local community leaders. And since then, we've definitely done direct education to at least 10,000 people throughout Philadelphia. We've offered free screening probably to over 6,000 people and have really increased vaccination rates. I think probably the most important thing we've done in Philadelphia is create a model by which other cities around the U.S. then base their work. So we've been able to use Philadelphia as this is what works, this is what doesn't, and here's how others do it. We now have a coalition called Hep B United. We're in 29 states around the U.S., and we're helping others to take what we learn here in Philadelphia and really have kind of put hepatitis B on the map, I think, and engaged communities around the country to sort of take up. If no one else was going to take up the cause of hepatitis B, then we in the community were going to do it. And it's still being run today, so Dr. Catherine Freeland now runs and directs Hep B United Philadelphia along with Michaela Jackson, and together they're making sure that everyone in Philadelphia should know their status for hepatitis B. If they have hepatitis B, we help them find care, and if not, we help them get vaccinated, and we're very pleased to continue that work.
Just like that, we are back on schedule. So we have time for a couple more questions, and then I'm going to be opening it up to the general audience for questions. But before I do that, I know we said we weren't going to get political, but this is for any of you, how do you think Dr. Blumberg would have felt about this current time of tremendous scientific innovation, but also scientific vulnerability? Anyone want to start?
He would have been really thrilled with the speed and kind of dedication around COVID that vaccine was created in such record time, and it's such a great vaccine, and the collaboration that made it possible. He would have been so excited about that, but he would have been absolutely horrified by what's happening now. And he was a very optimistic person and did not get down about many things, but I think he would have found this a really difficult moment and would have been angry and not despairing, but horrified is the right word, I think. I think you would, yeah.
Okay. And then what is one way that we can continue to carry on Dr. Blumberg's legacy into the future?
Well, that other question was easier. Well, I mean, I think that, set an example of curiosity, believing in science and facts and research and supporting research. And of course, you know, so many of us here were mentored by him in one way or another. And his legacy continues to be I think the commitment to life and optimism, research, curiosity. I always felt kind of bad about myself, thinking I didn't really measure up, because he was so general and broad, and I tried to be so focused. Well, you know, I'm actually not that focused, but when I think about it. But his philosophy was, as Mark Thompson, her husband, was speaking, was to look at everything, and Harvey Alter got into that too, how he sampled. And in my little vignette here, I'm reminded of how he took me on a walk with my son through the Pine Barrens, and yeah, could identify anything. He used so much information, and then would, of course, deduce. That's really his message. I think a love of learning, commitment to people, and an optimism. But I certainly agree with you, Jane. He would be tested by today. Oh, he would also be thrilled by AI. I mean, he would be the first. He was using email. Anyway, early on. I mean, he kind of, yeah.
I think for me, one of the things that I learned and try and implement is how you take care of the world around you. So one of the basic tenets of Judaism is tikkun olam, to repair the world. It's something I know Dr. Blumberg took very seriously, and I think something we can all think about doing is how do we help repair the world, especially during trying times, and even in a small, tiny way. How do you make the world a better place?
And now we'd like to open it up for discussion from the audience. Are there any questions that people would like to ask of any of the panelists?
So we have some mic runners, so just raise your hand, and
Yeah, raise your hand, please.
we'll
so
get the mic over to you.
Okay.
I saw your hand. Right here.
Yeah, a great panel discussion. It was very informative. I just, something I forgot to say in my talk that I wanted to add is, you know, Blumberg wrote this book, The Hunt for a Cure Virus, but I wrote a book, The Hunt for an NIH Parking Space. No, it was a great session. Thank you.
We had a question.
I wanted to ask you all, with the information that's coming out of the Department of Health right now, which is questioning birth dose of hepatitis B and whether to continue it, what that impact will have in getting vaccines to people in the community in terms of how it affects insurance, how doctors get their information, how you all see making sure that all those lives that have been saved continue to be saved.
Well, I'll make this comment that the ACIP recommendation for birth dose hepatitis B really was aimed at preventing perinatal transmission, and many pregnant women do not know that they might actually have hepatitis B and are chronic carriers. So the fact that we actually have this birth dose has been really life-saving in many ways in helping to prevent what could be a chronic hepatitis B and or possible liver cancer sometime in the future. So I think right now hepatitis B, I mean, measles and mumps and rubella, they're kind of like big things that have the public attention. The public doesn't really have the full appreciation of hepatitis B. They don't understand maybe about why would we give this birth dose. And so they're sort of throwing out this trial balloon of saying, maybe, you know, we should look at this again. And I hope that one of the reasons why we have this forum today, and we need to be all speaking about this, is that this is a disease that has been enormously successful in trying to reduce or prevent perinatal transmission for hepatitis B, and we should not mess with success, frankly.
Yeah, just to build on that, hepatitis B is the leading cause of liver cancer worldwide. About 1 million people every single year, 1.1 million people every single year die from hepatitis B-related disease, primarily related to liver cancer and cirrhosis. And hepatitis B is primarily transmitted mother to child at childbirth, and as Walter said, the only way to stop that is giving the birth dose. So before we had universal birth dose in the US, about 18,000 babies and young children every single year in the US were infected with hepatitis B. You're basically saying on the first day of your life, you deserve to get this infectious disease. We're not going to prevent you from getting it. So by the way, since we've been giving the universal birth dose, we've decreased infant and childhood hepatitis B infection by 98%. So we went from 18,000 kids a year in the US to almost 0 kids in the US that are infected with hepatitis B. And so what an incredible success that is. And so we've now saved all those kids from lifelong fear and anxiety and stigma and discrimination and worrying about dying early from liver cancer. So what I would say, and I think Mark brought up that over 1 billion doses of the hepatitis B vaccine have been given over the last 50 years. I don't know of anything that's been better tested in the world. We have more safety data on the hepatitis B vaccine than probably anything else worldwide. We know it's safe and we know it's effective, and I agree with Walter that we should all be shouting from the rooftops that why would you mess with this when you can literally save hundreds of millions of lives?
Hi, I'm John Chernoff. I'm the director of the Fox Chase Cancer Center where Barry worked for so many years. So I'm going to start with a comment, then it will lead to a question. So I had the pleasure of working with 2 Nobel Prize winners at Fox Chase, Barry being one and Ernie Rose being the other. And these 2 gentlemen, couldn't have been more different in their approach to science. Ernie Rose, who's, we're not honoring him today, but he was the ultimate sort of lab rat scientist who never left the confines of the 4 walls of his but yet he came up with great discoveries about ubiquitin. And Barry, as we've heard, was more like a Darwin or a field scientist using the inductive approach. So here's what leads to the question now. So the inductive approach to science, and we are in a philosophical society, so I don't feel too bad about talking philosophy, was already getting difficult to fund. I don't want to say going out of style, but even before the current administration was harder and harder to ask the sort of questions that he asked. And I'm pretty certain in today's environment, his work that he did at the NIH would never be funded. And so the question is, what can we do, if anyone has the wisdom, to get back to a little bit more of that style of science? Because right now, it's all deductive. And even that is hard to fund. So I just leave that as an open question.
Well, that's a great point. And you're absolutely right. And Barry was among the first to admit that his kind of work and approach would not be funded in today's environment, or last decade's environment. You're again, this idea, almost philosophical approach, broad approach towards science with open minds. I don't know. It's a model, and it's kind of the disappearance of that model is all over the world, not just in the United States. And the only way that I could think of it would have been for organizations like the NIH to actually make a special effort to encourage and invest in that kind of thing. Or you can have, there are now some very well-funded foundations that could, I'm thinking of the Hepatitis B Foundation, you can help make it well-funded, but there are foundations that are, I think, more committed to that kind of generalist, inductive approach to research and discovery. It would have to come almost from the private sector.
I think, and he was very much aware that his approach was pretty rarefied, and even at the time that he was very, very lucky indeed, and knew that his the director of Institute for Cancer Research at the time, Tim Talbot, was incredibly generous and had complete confidence in his approach and encouraged him to do it that way. Yeah, and Anna can testify to that.
I will just add, while the microphone is coming over, not for large-scale projects, but the APS does still run a fellowship program for field research. We give out about 300 awards a year, usually for more junior scholars or for beginning research, but we are having a conference on the future of field research this fall. So if you're interested in participating, it will be a hybrid event, so you're all more than welcome. The event is already on our website. And I believe this will be the last question for the Q&A.
Oh, well, I'm not going to say a question. I'm going to say that working more than 40 years with Baruch Blumberg and Tom London, the thoughts of how to do research was something that Barry always discussed. He always had conferences every Friday morning, and you better show up. And he always discussed multiple research projects within his knowledge and with what we were doing. So he was always connected to us, and he, as Jonathan just said, knowing Ernie Rose as well as I did too, because my ex-husband worked for him, I was acquainted with more than one Nobel Prize winner, but Barry was always informative, always asked questions, and always knew what we were doing. And that he and Tom always knew what was going on, and that was important. I don't think people realize how much time you have to spend. Harvey does, because he spent a lot of time in research. When you do research, you spend a lot of time, and you need the people around you to talk to and to discuss what's going on. And Barry was good at that, very good at that.
I fibbed. I'll let one more comment. I'm sorry. I fibbed.
Just want to say of all the things that have been said, obviously are correct about Barry. The one thing that he left me with was the need for persistence. The Australia antigen story could have ended at the very beginning. We had a new antigen. What did it mean? Nobody knew. It didn't excite anybody at that point. But Barry spent years and years and years, hypothesis, failures, new hypothesis, and stuck with it for the big payoff. And that's the thing, that was his strength. But that's the thing that's now not happening anymore. Same with hepatitis C. It was 40 years, 30 years from beginning to end. You could not fund these things. You don't know where things are going to go at the beginning. And there's no room anymore to fund these long-term perspective or observational studies. And that's everything is now is short-term, drug-directed, which you need, but the basic science part and the translational part is getting diminished, and that's very sad.
Well, I think we have one more set of videos. Did we want to clear the stage before we run these? Okay. Thank the presenters.
The first B that comes to mind when I think of Barry is brilliant. Of course, Nobel Laureate, well-traveled, research papers, colleagues, master at Balliol College in Oxford. The second B that comes to mind is basic. Barry was just as comfortable doing hiking along the trails in Europe and Asia, jogging, and bicycling on the towpath in Bucks County. I remember when he stopped at our door one time with his complete bicycle gear on and just stopped to say hello on his way down the path. The third B, which is very important to me as a co-founder of the Hepatitis B Foundation, was Barry's discovery of the hepatitis B virus and also its connection to liver cancer. And it was just an incredible thing that he did when we were starting our fledgling foundation back in the 1990s. He was Tim Bloch's mentor, our co-founder, and he was just supportive the whole way through. So I'm thrilled to be able to be part of this 100th year tribute.
Hello, this is Robert Gish calling in from San Diego for this wonderful memoriam to Baruch Blumberg and many happy memories. Remember Dr. Blumberg as being an incredible humanitarian an incredible scientist, and helped change the world. And I remember Dr. Blumberg every day because I am checking surface antigen and hepatitis B triple panel on all of my patients and trying to spread that message throughout the world. I'm super happy to be part of this wonderful honorary event, and I am thinking about changing the world through these wonderful tools that Baruch gave us with this hepatitis B discovery, and importantly, as a kind and wonderful human being.
So I rather abruptly ended the panel conversation. Can we have a round of applause, please, for the speakers? Thank you. And then I'd like to invite one back up. Timothy Block is giving our closing remarks for this event.
Well, first, thank you to the APS for providing this great venue and for the organization and words. Thank you very much. You know, this is just an awesome responsibility for me to close this ceremony, this event, because we've heard from some great speakers. I'm looking down at Dr. Harvey Alters, from Mark Thompson, Sherry Cohen. I really enjoyed listening to those comments, and today has given me the tremendous opportunity to remember Dr. Blumberg and all he did, and his philosophy and style of science, which is, yeah, as we heard, is kind of a diminishing art. His approach, and hearing what some of the speakers talked about makes me think: what are we losing if we lose that style or that approach towards research? But we're lucky that he was able to do what he did and create so much momentum in science. Well, yeah, I do have to agree that persistence was definitely, as Harvey Alter said, was again another jewel that in his box that he certainly tried to teach me, and I know he tried to teach everyone who worked with him, because that's been so important. Well, what I really want to say is I want to thank you all for coming today. I want to thank my fellow panelists, and of course the speakers, and the Hepatitis B Foundation, Sherry and Maura, for putting this together so seamlessly, and of course the organization. It's a real pleasure to be here. I understand there's a reception right after, and I know the panelists and speakers will be around if there are more questions. Again, until the next great discovery, thank you all. Bye-bye.